there's been a lot of progress in the biomarker landscape over the past 20 years. It started off, I think, about 20 years ago with CSF biomarkers, when we were able to actually find biomarkers that reflect Alzheimer's disease in CSF. In 2004, it for the first time became possible to visualize amyloid, one of the pathological hallmarks in Alzheimer's disease, in living patients. So that was a real breakthrough. And we're actually now in the stage that these amyloid PET scans are being used in clinical practice, as well as the CSF biomarkers are being used. The good thing of CSF biomarkers is that they give you information on amyloid, tau, as well as inflammation, even cell count or protein or glucose. So it can even give you information on neurological diseases that are not related to neurodegenerative diseases, but that you may have in your differential diagnosis. An amyloid PET scan obviously gives you information on the presence of amyloid or not, but that's about it, right? And it's a lot more expensive. But the good thing is that you can actually visualize amyloid. And that sometimes helps in bringing a message to the patients about, quite serious brain disease. I think that's past and present for biomarkers. And the future, I think the very near future, and that's what my presentation is about, is the plasma biomarkers. They have been going through a major quick development over the past few years. And we're now able to actually measure amyloid and several forms of phosphorylated tau and total tau with special techniques in blood. I think in the near future, we may be able to apply those in clinical practice, not so much for really confirming a diagnosis of Alzheimer's disease, but maybe more so for as a kind of a pre-screening tool. But we'll have to see in what way they are developing, but it's very promising. And I think we will be applying them within 5 years. For the future, a bit further away, I'm working currently on a biomarkers in the eye, in the retina, and that would be even more patient-friendly than drawing blood. But for the eye, we still need to do a lot of development. For example, we're not even scientists at this point of time don't even agree upon the presence of amyloid or not in the retina. So we need to do a lot of work there. First, harmonize the scientific fields. But if that comes true, that would be a really great screening tool for Alzheimer's disease because it's quick and patient-friendly.